Good afternoon and welcome to the City Club of Cleveland. My name is Paul Harris and I'm president of the City Club's Board of Directors. I'm very pleased to introduce today's speaker, Dr. Akram, President and Chief Executive Officer of the MetroHealth System in Greater Cleveland. We welcome Dr. Boutros to the podium to present an informed perspective, which is what we like to do at the City Club, on how, in the face of significant challenges, we're doing as a region and as a nation in providing health care to the poor and uninsured. Dr. Boutros was born in Cairo and immigrated to New York with his family. He attended public schools in Queens and at age 15 had a life experience which he credits for his decision to devote his life to serving people. He was hit by a speeding truck while waiting at a street corner for the light to change as he delivered newspapers and spent 6 months thereafter recovering in a hospital. As he said in a Cleveland Plain Dealer interview shortly after he joined MetroHealth, the experience, quote, was a wake-up call that I meant to do something else, that I meant to help people, end quote. After high school, Dr. Boutros attended St. John's University, where I just learned he met his spouse, in New York, followed by the State University of New York Health Services Center, where he earned his Doctor of Medicine degree. He thereafter began his 2-decade and counting leadership role with large community hospitals, specialty hospitals, and academic medical centers. He served for 10 years in leadership positions, including Chief Medical Officer at South Nassau Hospital in Oceanside, New York. He next served for 2 years as Executive Vice President and Chief Administrative Officer of St. Francis Hospital, the Heart Center, in Roslyn, New York. Immediately before assuming his leadership role at MetroHealth, Dr. Boutros spent 2 years as president of a healthcare advisory consulting firm. Dr. Boutros is a recognized thought leader in management systems, a published author, and a frequent lecturer. He brings his extensive experience in blended medical and business acumen to MetroHealth at a time of rising healthcare costs and decreasing federal reimbursements. Those are significant challenges for a 175-year-old hospital system that today serves a population of over 1.2 million, approximately 150,000 of whom are reportedly uninsured. Now, on a wintry Cleveland day, it seems appropriate to note a comment Dr. Boutros made in the previously mentioned Plain Dealer interview, which reveals that he brings a sense of humor to his work. As he stated, quote, "This isn't Hawaii. I didn't come here because of the weather or because we have lazy afternoons. The mission of this organization is the reason why I'm here. It speaks to me, and it's what I believe is my life's calling. This is what I'm meant to do," end quote. So I present, on behalf of the City Club of Cleveland, Dr. Akram Boutros, President and Chief Executive Officer of the MetroHealth System.
Thank you, Paul, and good afternoon, ladies and gentlemen. It's really quite an honor for me to be here speaking at the City Club. 100 years of philosophers, politicians, community leaders, and even physicians who were able to spark dialogue and debate. It's really quite an honor. And thanks to my marketing team for putting up this a great introduction for me. I didn't know who he was talking about. On a serious note, this afternoon I want to share with you a really audacious plan. A plan that will radically transform how healthcare gets delivered. One that's going to move us from sick care to healthcare. I want to tell you a lot about that in the next 15 and 20 minutes. I think this approach, you may wonder why. Why now? Why today? Why MetroHealth? Well, really biggest reason is because the state of health in our community is a tragedy that affects us all. And we actually have ways. We found methods in order that we can prolong life. And not just prolong life in a sense of not prolong disease-free life. We actually found ways to be able to have people improve the economic contribution to our society, and we can and will be able to reduce the cost of health care. You know, I'm still the new guy in town. Actually, last Sunday, I celebrated my 6 months anniversary on the job. And yesterday was a really big anniversary for me. Yesterday was my 27th wedding anniversary to Suzanne. And our 33rd year of dating. And for those of you who know Suzanne, already know that she is the example that I try to follow. Thank you, honey. Before my arrival at MetroHealth, I knew about Cleveland, and I knew about really devoted sports fans. I knew about the arts and culture, and I knew about Clevelanders and how they embraced people who came to their community. What I learned more about is really some things that are very important to me. The first is the great culinary scene and the generous heart of Clevelanders. Today we're joined by the Cleveland Foundation, the Mount Sinai Foundation, the Gunn Foundation, St. Luke's Foundation, and the Sisters of Charity Foundation. Thank you for being here. And I learned some really important lessons. Boy, did I learn about the East-West divide. And I think I'm about to learn about lake effect snow. And although I'm not there yet, I know one day I'm going to love to tailgate in the Muni lot and Christmas ale. People ask me, I'm often asked, what attracted you to Metro? Well, it's working, the opportunity to work with like-minded people to affect the health of an entire community. There really isn't a lot of places you can do that. So that's what makes this job so special. And I had already known that MetroHealth had a remarkable national reputation for the quality of care we do, our commitment to teaching and research. And we really are a model to emulate well beyond what we're known for here, which are burns, trauma, and the care of uninsured. What gets me, though, what gets me is inside Cleveland, we're not valuing Metro the way people from outside Cleveland are valuing Metro. Inside Cleveland, we don't fully appreciate what MetroHealth is and what we do. And although we are among giants of healthcare, that shouldn't mean that we should forget what MetroHealth means to every community member of Cuyahoga County. You know, this concept reminds me of a story. Ann Mulcahy, how many people know Ann Mulcahy, the former chair and CEO of Xerox? So Ann is a spectacular human being. Ann came to teach at the Harvard Business School class, and we went out to lunch afterwards. So Ann related this story. She took the opportunity while she was at Harvard to spend the night with her mom, who lived right outside Boston. So in the morning, her mom was kind enough to make her breakfast, sat down at the kitchen table to have breakfast, and her mom said to her, "Ann, what are you doing today?" She said, "I'm going to Harvard Business School." And true to form, her mother said to her, "That's nice, honey. What class are you taking?" So as I travel through our 18 different locations, I see the high quality care we deliver. I see the passion of our staff for our mission. Patients stop me and tell me about their gratitude, not only for the care and compassion we've given them, but for the restoration of dignity when no one else was there for them. That's what makes MetroHealth special. And each of these interactions tells me we got it right when we refreshed our mission. Before you is a card which has our mission and vision. I'd like you to turn to it now. Our mission represents a pact with you, the community, and each and every patient. Our mission is leading the way to a healthier you and a healthier community through service, through service, teaching, discovery, and teamwork. As CEO, I see my main role in this mission is to be a fearless advocate for the health of our community and the health of our patients and MetroHealth. So let me tell you about what does it mean to lead the way. Leading the way is that MetroHealth is going to plot a course that is radically different than how most health systems define themselves today. You see, any patient with heart failure can enter any one of our fine institutions in Cleveland and get fairly good, high-quality care. What makes this new model different is the care for us will not stop when the patient leaves the hospital. In this new model, our pharmacist will go home with the patient to help them with their medications. Our nutritionists will go food shopping with the patients who have chronic diseases and dietary sensitive conditions to help them make better food choices. Our health coaches will work with the patients to achieve their goals. Not my goals for them or your goals for them, but their goals for themselves. This radical approach requires that we understand patients on multiple dimensions. We need to understand them at an educational level, socioeconomic level, social level, and spiritual level, because that's what makes them individuals. I want to tell you about Mary. I met Mary a couple of months ago. Mary is a single mother, middle-aged mother of 4 kids, and she lives very close by to our West 25th Street campus. Mary's got very despondent because she was looking for a job for many months. Actually, I think she said 2 years without the ability to find one. Her doctor thought about putting her on antidepressant medications, very expensive antidepressant medication. Mary explained to the doctor, if I could only get a job, I think I would be happy. What's the problem? Mary's teeth, she had lost many of them. The remaining ones were discolored and misshapen. Mary never smiled. When she went on an interview, she absolutely never smiled. She spoke with her mouth almost completely closed. Solution? Fix Mary's teeth. The result? Mary has a job, she's happy, no antidepressants. So we need to understand that affluent executives in Pepper Pike and widows in inner city require radically different solutions. Not that one is needier or has greater challenges, just that their challenges and the solutions we provide them are uniquely their own. And it requires a distinctive relationship with their healthcare providers. Do you know that researchers at CDC and the Canadian Institute for Advanced Research have identified 4 determinants of health? 50% of your health is based on your behavior and lifestyle. 20% is your individual biogenetics. 10% is the environment. And 20% is the care we receive. Only 20%. And I know what you're thinking. Really, Akram? You're a fine example of someone who could use a healthier lifestyle and behaviors. And you'd be right. I know how hard it is to change your behavior and become healthier. I know that because I've lost 140 pounds and I've quit smoking. And I didn't and couldn't do it alone. I needed help and support from my family, my friends, my doctors, and even my employer. It's going to take all of us to be able to change this. And still, I have more to do. Unfortunately, most of our collective energy has been based on, on this 20% of treating people after the fact. Don't you think we should work really hard on changing the attributes that cause the disease in the first place? If you're skeptical, and I know some of you are, about how can a healthcare system make this radical change and focus on the other 80%, I think you're among the majority. And you could also rightfully ask, how can a hospital, public health system in Northeast Cleveland ignite the change for this radical new system? In my view, it's our unique combination of community roots, teaching, and focus on Cuyahoga County that will make us leaders in this environment. It will help us ignite this revolution. We have 175 years of history of care. We deliver tremendous amounts of research in healthcare delivery. While others are known for their new inventions, we know how to take care of patients better. But most importantly, it's really our charter as guardians of the healthcare of the community. Some people don't know how expansive MetroHealth is, but we'll see 1 million visits this year. And some people don't know what great quality institution MetroHealth is. In 2010, we're among the top 1% of hospitals nationwide who received the Pinnacle Award, Premier Award for quality for superior outcomes. Did you know that? Most Clevelanders don't. Our staff is top-notch. There are dozens of physicians included in the best doctors in America. Our nursing staff is exemplary. They represent the very few who've received Magna designation. And thank you, Mavis, for our Chief Nursing Officer, for making that happen. Teaching is also a very important part of our approach. Another statistic you may not know is this year we will train 1,300 doctors, nurses, students, and fellows. And we, in 2014, will be celebrating our 100th year anniversary of partnership with Case Western Reserve School of Medicine. Every physician, including me, has a faculty appointment. And together, we've trained more than 13,000 physicians. Research is a very important part of our mission. And in the 20th century, we were leaders in fighting diseases such as tuberculosis and polio. Today, we have another audacious project. We are going to combat a bacteria that is uniformly found in every hospital in America. C. diff causes up to 30% mortality. It's a really tough bacteria to kill because it has an outer shell. That outer shell permits it to live 2 years outside the body. We had some researchers come to MetroHealth, and they went through the rooms where patients with this disease had just been discharged. And they came around and said, folks, the distribution and amount of bacteria in these rooms is the lowest we've seen nationwide. We think you have the opportunity to eliminate this disease and become the first hospital in the nation to find a way to do that. And by golly, we're going to do it. And I know the physicians who are here today have all worked with us to make the change that will permit us to do this. One of the things you may not know is that most hospitals don't do well in hand washing. And I know our Chief Medical Officer is not here, Dr. Al Connors, but man, Al wears this on his pin, on his lapel every day. You know, wash in, wash out. Al is constantly telling people to wash their hands. This is just one effort of breakthrough research that we're doing. We have Dr. John Cedar, who is our head of research, and John is involved in healthcare disparity research. We want to know how healthcare is different for people from of different races, socioeconomic conditions, and different communities. You know, I'm going to get to the second part of our mission, which is a healthier community. You would think, with all the tremendous resources that we have here, some of the top hospitals, ranked hospitals in the nation, that Cleveland and Cuyahoga County would be an incredibly healthy place. We rank 67th out of 88 counties in Ohio. And Ohio ranks a paltry 37th in the nation. This is a big job. We have to all be deeply committed to changing that. And at MetroHealth, we are. I can tell you about 2 programs. One of them we just started, and both programs involve children, but I could tell you about the adult programs as well. We just started a program last month in which we put doctors, we put a clinic in the schools. We did this in Slavic Village in partnership with the school districts and with philanthropists. Why? Because our children, healthier children, do better in school. And our kids sometimes don't have access to good health care. So we not only give them immunizations and checkups and everything else, we actually make sure if they're asthmatic or diabetic that they don't get sick and go into the hospital. We want to do this for 20 schools. We want to be able to have, in the next 2 years, 5,000 kids under our care. And so the parents don't have to come to school. The kids don't have to miss school. No reason to have a babysitter, to go to the doctor, or no reason to take off from work. The other program, which is really near and dear to me, is that we've accepted responsibility for the 1,700 children in this county's foster care program. These children are often sent from one doctor to another. They can account for up to 8% of the Medicaid enrollees, but typically account for up to 25% of the Medicaid expenditures. You would think with all that money, they're getting Cadillac care. My dog gets better care. Today, we have accepted responsibility. We're providing them with a medical home where every child will be cared for by one of our team members. And if they decide to go somewhere else, our nurse practitioners, psychologists, care managers will still follow them. They'll even make house calls to make sure they're getting the care that they need. And this program may cost the hospital about $400,000 to do. And thank you to the board of directors for approving that. And we have Mr. Tom McDonald, our chair of the board, here today. That comes out to about $235 per child. Isn't that a small price to pay for the health of our kids and their future? But done well, the program will save Cuyahoga County $3 million. Some of you may know that we're leaders in collaboration. We've put the North Ohio trauma system with Cleveland Clinic at a time when two hospital trauma centers were closed. Since inception, we unequivocally reduced trauma mortality by 50% and have improved the lives of hundreds of people. We're also founding members of Better Health Greater Cleveland, a collection of 60 healthcare systems, insurers, employer groups, and community organizations committed to the care of patients with chronic diseases. In just 3 years, we've averted 1,900 hospitalizations and close to $14 million in associated costs in Cuyahoga County. Thank you, Dr. Randy Siebel, for leading the program. But these programs are just models. They're models for us to collaborate with the Sisters of Charity. And I can't tell you, I couldn't find two better friends than Sister Judith Karam and Terry Kessler, the CEO of the Sisters of Charity. Thank you for being such good friends to me. So we're going to do more. We're also going to be very innovative. How many of you have a cell phone? Can't go home without it, right? Don't leave home without it. Well, we're going to do a unique program. We're going to take a program that was developed in South Africa, and we're going to adapt it to high-risk patients here. Imagine this. We're going to give our high-risk patients a smartphone that's going to connect them to their providers for free video and phone conferences. It's going to help them get text message reminders to take their medications, their lab appointments, and doctor visits. It's going to connect them to a health coach, and it's also going to connect them to social support services. Here's the really cool part. The patient can earn extra minutes, free extra minutes, to speak to family and friends if they become engaged, if they take their medication, if they record their blood pressure, if they make it to an appointment, and they get prizes when their glucose is in control. It's an amazing concept. They become dependent on it, and therefore we switch the way people's lifestyles are. I can't wait to try mine. We also have an extraordinary commitment to electronic health exchange of information. And Dr. David Kalbar, our Chief Medical Information Officer, the guy in the beautiful red bow tie, has been leading the way here. Since 1999, we became the first public hospital to put in Epic Health System. And today, we're the first hospital in Ohio to be recognized for Level 6 certification for outpatient and inpatient electronic medical record use. So I want to just mention last thing is that one of the things people talk to me about is, what does Metro do for the uninsured? Everybody's not, all the other hospitals are not-for-profit and the like, and they do lots of good. But just so you know, for the past 6 years, MetroHealth has been operating in the black. And during these 6 years, we delivered more than $700 million of free care at our cost to the uninsured. Now, our foundation support, you would think is a lot. It's less than 5% that of Cleveland clinics. 1/20th, folks. And the support from Cuyahoga County taxpayers is wonderful, but it's less than 5% of our revenues. When you compare that to Cook County in Chicago, they receive 37% of the revenues from taxpayer dollars. And the average public hospital health system of our size receives 21%. So we're trying to do our part to reduce the burden on taxpayers. But we need partners. We need the philanthropies and the business communities to step it up and make sure they invest in the health care of our communities. Your donations will emblaze your names in the hearts of those most in need. Your help will revitalize our facilities. We don't want to build another hospital or healthcare system. We want to build something that works for you and for the future of healthcare. As a matter of fact, we're so committed to this, we are taking our space in the Global Health Center for Innovation, and we're going to have it invite the public, professionals, the officials, and researchers to decide what we should look like. We're going to have alternative site plans, and you get to tell us which one you like. We're going to have alternative inpatient rooms, alternative outpatient technologies, alternative even pathways, clinical pathways, and you get to tell us which best fits your needs. This new facility will be a health system, a health facility designed by the people, for the people. So I want you to partner with us. I need you to partner with us as we go on this journey. It will be definitely a transformational journey. Together, we will improve the healthcare of our communities. Together, we'll be an example to others to follow. So therefore, we will impact the healthcare of the nation. Others will look to Cleveland as a model. To me, that's why this is the best job in healthcare today. Thank you very much.
Today at the City Club of Cleveland, we are listening to a Friday forum featuring Dr. Akram Boutros, President and Chief Executive Officer of the MetroHealth System. We're going to return in a moment to him for our traditional question and answer period, and would ask you to start formulating your questions now. And when you ask them, please try to keep them brief and to the point so we can get a lot of questions in our remaining time. We welcome all of you here today and those joining us via broadcast on WVIZ PBS, 90.3 WCPN, and 104.9 WCLV IdeaStream, WTAM, or one of our many broadcast partners across the country. Broadcasts of the City Club are made possible by Cleveland State University and PNC. Our live webcast is supported by the University of Akron. Next Friday, December 13th, the City Club will host a panel discussion on the death penalty in Ohio. For a complete list of our upcoming programs, to make a reservation, or to order a CD or DVD of one of our many programs, please visit our website, and that's www.cityclub.org. We welcome guests today at tables hosted by, and there are a lot of them, Baker and Hostetler, the Center for Community Solutions, Case Western Reserve University, Francis Payne Bolton School of Nursing, Cuyahoga Community College, Dixon Eaton's, Friends of Joe Simperman, the Legal Aid Society of Cleveland, the MetroHealth Foundation, PNC, St. Luke's Foundation, Sisters of Charity Health System, Visiting Nurse Association of Ohio, and last but not least, the MetroHealth System, Government Relations and Community Affairs. Thank you all for your support. And as we frequently do, we welcome students here today. Student participation is made possible by a generous gift from the Charles E. Sprague Charitable Trust. Today, we welcome students from Shaw High School, Max Hayes High School, and West Jaga High School. Will our students please stand and be recognized? Now, as promised, we're going to return to our speaker for our question and answer period. We welcome questions from everyone here today, including guests. Holding the microphones today are Program Director Carrie Miller and Administrative Assistant Kirsten Pianka. First question, please.
Doctor, you spoke about the health care delivery of your system in Cleveland and throughout the country. And of course, the Affordable Care Act is making many, many changes in health care delivery throughout the country, particularly by bringing into the system literally millions of people who formerly had no insurance. How does your system propose to take care of all those additional new people, particularly with the relative shortage of internists, not only in Cleveland, but throughout the country?
Can you tell me your name?
The question...
Your name.
Your name, Stanley Edelstein.
What's your name?
Okay.
My name?
Yes.
I'm Stanley Edelstein.
Okay. Nice to meet you, Stanley. I'm Akram. So Stanley, we have a really unusual organization in MetroHealth. We're the first organization, hospital and health system in Ohio, to do something called the Medicaid Waiver Project. We've been taking care of these patients for the past year. We actually have nearly 30,000 of them new Medicaid enrollees that we've been taking care of. So we're probably the only people, in earnestness, we're the only people who actually know what they're like, what their needs are. So if you take all the physicians and provide care the way we're providing it today, we are in big trouble. If we follow the path that I outlined for you today, we will need less frequent doctor visits. We will need less testing. We will need less surgery, and we'll be able to take care of more people at a lot lower cost and keep them healthier. And by the way, you just got one more internist in Ohio. That's me. And can I just make a request? Ask me your toughest questions first. Please don't leave them to the end. I'm a New Yorker. I've got thick skin. This isn't all fat. Some of it is thick skin. So go for it.
Well, I grew up in Queens, too.
Oh, all right.
My question is based on a couple of facts. A few years ago, George W. Bush said, if you're sick, go to the emergency room. The New York Times reported a couple of days ago that a person who needed 3 stitches got a bill that amounted to over $500 per stitch.
Yeah.
I'd just like you to comment as to Metro's delivery of emergency services and their cost.
So I'm going to make, can you tell me your name too, please?
Donald Cairns.
Hi, Donald. There are 2 questions. One is about the cost of health care. The bills you get have absolutely are not in any way associated by how much you pay. The billing methodologies in hospital has been broken for many, many years. We charge sometimes to an insurance company $1,000 and get paid less than $50. So we have to fix that. J.B. Silvers, who is on our board, has been talking to us about it and said, we must be leaders in transparency. So are we doing a good job today at MetroHealth of representing real cost with the bills we're sending out? Absolutely not. Are we going to do better? Absolutely yes. When you talk about our emergency room services, I'm looking at our current chair and probably the longest sitting chair of emergency services in Ohio. Dr. Emmerman leads a group of extraordinary physicians who I sometimes think about hurting myself so I can go to the emergency room. I have to tell you, I go to the ED, and sometimes they're not happy about it, at 3 o'clock in the morning, at 11 o'clock at night, just to see them, because it's really the front door of the hospital many times. So, and I would be remiss if I didn't recognize two other emergency room physicians. My hero, Dr. Tom Collins, who just won the Red Cross Hero Award last night. Tom? And the newest person of the executive leadership team, Dr. Sarah Lasky. Dr. Lasky is our Chief Experience Officer. She likes to tell people it's CEO. And I tell her, no, it's CXO. But Dr. Lasky is working very, very hard with the rest of the organization to change the way we interact with our patients. We sometimes treat our patients at MetroHealth as if they don't have a choice. And that's just plainly wrong. We need to treat them as if they're my family members. And I tell the staff that because I don't know if they like their family members or not. I happen to like mine. So that's why I want them to treat them that way. Boy, you popped up quick.
Doctor, my name is Bob Lustig. First of all, congratulations to Metro. I've had some personal experience there through a friend in the past year. The concern and compassion shown by the staff is absolutely outstanding.
Thank you.
My question relates, however, to your advocacy of preventive care. We seem in this country to be determined to reinvent the wheel for every problem we face. Is there a system outside of the United States that you believe we should emulate to accomplish the goals that you have expressed?
Yeah, that's an unbelievably good question, Bob, because we seem to think it's only our way will work, right? So there are a lot of lessons to be learned. The issue is the social norms in other countries are very different here. We think, and I know most people do, more is better. Bigger is better. Look at the cars, right? Bigger is better. I can't tell you how many older patients who I've taken care of who would run into my office very proud that they got an MRI. Isn't it wonderful that my orthopedist gave me an MRI? I go, for what? They said, my knee hurt. I said, you have arthritis. They said, yeah, but now we know for sure we have arthritis. I'm like, I know. So it doesn't fit. There is nothing that fits with our current societal norms. There are plenty of lessons to learn from even some of our emerging countries. You know, we should be ashamed by our infant mortality rate in this country. And that doesn't require us to do something tremendous. There are places in India who've done better than us, who've made that transformation. So we can learn in certain instances how to do that. Appalachia has really terrible infant mortality. We need to do better, and we can learn from them. Hi.
Hi, Dr. Brewster. Thank you, Jean Polster. My question is really almost a follow-up to the gentleman's question before, and it really relates to the revenue model that healthcare operates under in this country, which is really driven towards testing and procedures.
Yeah.
And a lot of the things that you described in terms of the positive public health impact, like home visiting and prevention activities, are not currently reimbursed by insurance.
Yeah.
How does MetroHealth propose to bridge that gap during this transitional time in healthcare?
So I have to tell you, Gene, I'm always been perplexed by the leadership, health system leadership approach to solving these problems. We talk about the dollars first, and frankly, I've never found it to be useful for me. I like to figure out what's the right thing to do first, and then we can figure out how to do it right. So for us, I've expressed to my board, and I've gotten a resounding support for it, that 50% of our revenues within the next 3 to 5 years will be under either risk contracts or shared savings. This way, I can control all the healthcare dollars and make sure it goes to the right area. In the meantime, though, we are going to be investing. We're going to be investing $2 million in taking care of the elderly in a way that we may not get a penny back next year. And that's okay, because they're going to get healthier.
Dr. Boutros, first of all, thank you for coming to Cleveland. We are very blessed to have you. I'm sitting back here with these beautiful, bright young people, the next generation in this community, and you mentioned health disparities, and I think that these are the folks who are going to really address the health disparities in our community by making a decision to become educated in healthcare and work in healthcare. And the media is kind of discouraging from doing that. So what would you say to these bright, beautiful young people in our community about opportunities that they can take to become part of the solution to the health disparities in our community?
Come on over, we're hiring. So it's gonna take a different upbringing. They don't have the same social boundaries that we normally have, that we were grown up with. My daughter, Jasmine, our eldest, she's not my daughter, she's really Suzanne's daughter. I was just there for the event. So our eldest is Jasmine. She's 22 years old. She's doing her 4th year of college in Abu Dhabi, in NYU in Abu Dhabi. She goes to school. There are about 600 kids. It's a fairly unique program. The most they've traveled, most kid who studied is in 24 different countries. I think Jasmine only did 12. She's a slacker. But they represent, her class, I think 600 kids, I think represent 94 different countries. Okay? She doesn't see any divisions in race, religion, ethnic upbringing, or anything else. So you guys, we need you. We need your point of view. We need you to help us see our mistakes. And the really great thing is that no matter how well we do in healthcare, people will always need both care and always need health. So there will always be jobs for you. So come on over, we're hiring.
Hi, I'm Justin Dusnes from the West Geauga High School. I was just inquiring as to what MetroHealth means to high school students right now.
Yeah, I'm not sure. I honestly am not sure. I can tell you we're going to mean a lot more. We have on the drawing table a program that's going to take committed high school students and give them summer jobs and ability to work. And if you decide to stay in the area and in the neighborhood, we'll figure out how to help you with your college. And if you stay in the neighborhood and the area, we'll figure out how to give you a job when you graduate. I don't want people to leave Cleveland. Now that I'm here, I want more of them here. You guys are like the best kept secret. It's unbelievable. We have, I think, one more question.
My name is Shaquille Tyson from Shaw High School, and my question is, when you were working in South Nassau, one of your focuses were teamwork and team chemistry. Do you think that helps out more with healthcare in the community, and can it help out with healthcare in Ohio?
Oh, you know, you guys are just so smart. I'm glad the young ones are asking the questions. So absolutely. So it's an amazing concept. Now, you need to know, physicians are trained to be lone rangers. We're trained to work kind of alone in medical school. We compete with one another. We get told that, hey, don't believe anything anybody else tells you because patients' lives are at stake. You must check it yourself. And then when we graduate, we tell them, okay, you're a part of the team now. Go ahead, go work with others. We're like, hey, I was working alone. Leave me alone. So teamwork is really one of the great tools that we use at MetroHealth to help things work well. We have a guy named Dr. Jim Campbell. He is a wonderful human being, extraordinary guy who decided, I am going to take care of seniors in a very different way. It won't be about me. It won't be about the accolades that I receive. It's going to be about the teamwork that we do together to be able to serve them. It's going to be, they're going to be able to contact any of us and get the same kind of care. He really is one of the pioneers of teamwork in senior care. So absolutely, it is one of the great tools that we're going to have to use. And thanks for reading my propaganda. It's really nice. Oh, one more question?
I think we still have a few minutes left.
Oh, good. I didn't know what that meant. It means 6 minutes, I guess. Okay.
But make sure you talk to that side of the room, too. They're a little shy over there.
All right.
But we don't want to just get your face, too. They want to see it, too.
Are you saying something about my back?
I'm seeing your face. They don't want to see your back. I am really quite dazzled to hear how earnestly you are seeking to treat the whole person and find your way down inside the psyche of your patients so that you can understand and predict what they're likely to do as you supply your 20% of the care equation and they supply their 50% of the lifestyle determinant of their health. And in looking at the whole person, I, for one, have been excited at the potential of the electronic medical record to carry forward a picture of the patient so that the person who parachutes into an immediate situation has an opportunity to look back in the person's history and see who is this person we're treating. Has the electronic medical record even begun to provide that kind of support for the whole person treatment that you're talking about?
Yeah, no, I absolutely think so. I think what hasn't happened yet, so I think the innovation and the electronic medical record and the technology is all there. What hasn't happened yet is that we haven't taught people that when you're parachuting in, don't just fix the problem that's before you, try to figure out what the person is. So that, I think, is a change of mindset and approach to patients that we need to do. But from an EMR standpoint, you would be amazed what's available today. Absolutely amazed. I am. This guy keeps telling me, I go, really? We can do that? So, who's on this side? Come on, you gotta, hello.
Hi, I'm Robin Bachman. I'm just thrilled about Medicaid expansion, as many of us are. And one of the areas that I'm particularly excited about is that we're going to be able to do more around behavioral health. I was wondering if you could speak to that as far as how we can do an even better job of taking care of those who need behavioral health care.
Yeah, if you're talking about a shortage, and Robin, good to see you again. If you're talking about a shortage in healthcare, behavioral health services, my goodness, is just really terrible. I mean, we don't have enough of it. And behavioral health, people have mental illness, need extra support. It's not a matter of taking a pill. There are a lot of things we can do with pills nowadays. But if you want healing, if you want adaptation, if you want people to be, productive members of society, we have to provide additional services and support to them. So I can tell you is that the problem is going to get worse because of additional people coming into the system. We thought we got things run well at MetroHealth until we did the Medicaid waiver, and we became overwhelmed, absolutely overwhelmed with the mental health care needs. And we've done a terrible job of being able to respond to it just because there aren't enough providers out there to be able to bring to the equation. So if you want a really good job, you want to help people, become a mental health specialist. And that means wrap up. So I'm wrapped. Thank you very much. I really appreciate it.
Today at the City Club of Cleveland, we have been listening to a Friday forum featuring Dr. Akram Boutros, President and Chief Executive Officer of the MetroHealth System. Thank you very much, Dr. Boutros, for an informative and lively presentation. Thank you, ladies and gentlemen. This forum is now adjourned.